Hello and welcome to the Swine Disease Reporting System. My name is Edson Magalhães here at Iowa State University.
Hello, my name is Giovanni Trevisan.
Hello, Daniel Linhares at Iowa State.
Hello, Guilherme César at Iowa State University.
So this new face here in our team is Dr. Guilherme César. Dr. Guilherme César, welcome on board. He's the new member of the SDRS team, so it's a pleasure to have you here. So today we're going to cover the SDRS findings for the month of April 2022 in this report. And we have as our special guest Dr. Dustin Oedekoven. Dr. Dustin Oedekoven, he currently serves as a chief veterinarian at the National Pork Board. He's also the president of the United States Animal Health Association, and also he's an adjunct faculty at the South Dakota State University. Dr. Oedekoven, he's a key U.S. animal health leader and has also previously served as a South Dakota Assistant State Veterinarian for 6 years and a South Dakota State Veterinarian for 13 more years. And he also was the interim secretary of the South Dakota Department of Agriculture. Dr. Oedekoven, thanks for joining us and accepting our invitation. It's a pleasure to have you here.
Yeah, thanks, guys. Really am glad to be here on the podcast today. I'm a big fan of your podcast. I like to listen to it regularly. So thanks for having me on the show today.
Thank you, Dr. Oedekoven. It's a pleasure to have you here in our podcast. So before we start our discussion, Giovanni, what is the main findings that we have in the previous months in the SDRS?
Well, April is a very interesting month. And let's start for PRRS virus. So the detection of PRRS virus is falling as expected for this month. But what really calls attention is that is having some outbreaks of PRRS virus in different production systems. That's because we found some connection chains to spread the virus along. And the new emerging strain that was the lineage 1C variant strain has been more detected in west of Iowa and Minnesota states. So there is some activity of that one going on those regions. When we look for the endemic coronavirus, Delta coronavirus and TG are following the trends of lowering the detection for Delta coronavirus or no detection for TG. But what is really interesting is that PD detection is really above expected, and that's going on since the end of January. Mm-hmm. And it looks like this is occurring because PD finds some ways to find some broke channels in terms of biosecurity of trucking wash or personnel moving across farms and moving off animals around, and continues to spread with increased detection over different regions. So we have in the Midwest, in the East Coast, so is a high level of activity for this agent going on. Mycoplasma pneumoniae, there was a little bit of increase in detection for the age category adult sow farm, and seems like that is due because there is more testing going on in terms of preparation for some herd elimination that's being taken care of some different production systems in the U.S. So that's a good sign that the industry is moving along for eradicating Mycoplasma pneumoniae in some of the production systems. And this month specifically, we're bringing another agent in the same page of Mycoplasma pneumoniae, that's PCV type 2, porcine cycovirus type 2 detection. And we also did prepare a bonus page explain those detections over time, and now we are going to keep following that agent on the upcoming months. And for influenza A, we had lots of activity going on at the end of March and the beginning of April, but as we go towards the end of April, that starts to decrease. So it's a good sign that we are seeing less activity of influenza A. So those are the high-level highlights for the SDRS this month.
Very good, Giovanni. We keep following that information. Just a reminder, so the SDRS we covered have the data from the VDLs, so we have algorithms here that will track that data and analyze, and we also have the input, which is very important from the advisory council group, that field veterinarians and producers, that we share the information with them, and we get a really good brainstorming, and we bring this information for you guys. So our first question to our special guest, Dr. Dustin Oedekoven. First of all, congratulations on your recent position as a chief veterinarian at the National Pork Board. Can you briefly comment on your new role and any milestone project that you would expect to contribute into your new role?
Yeah, thank you. I'm really excited to join the well-respected swine health team at the National Pork Board. They've done a lot of great work there over the years supporting research and just the ongoing development of swine health programs. So it's an exciting time to be in the swine industry, and I'm happy to be there. So a couple of the big topics that the pork board has as priorities. One would be, of course, African swine fever preparedness and prevention, and trying to implement activities in the industry that would help us respond to African swine fever and other foreign animal diseases. And then, of course, supporting research in areas that help fill knowledge gaps on ASF response. We've got a couple of depopulation and disposal exercises that are ongoing in 5 different states, aiding and assisting the industry and state animal health officials in, actually implementing depop and disposal plans. We've also invested in vaccine development, and there's also an ASF joint working group between the National Pork Board and the NPPC that is prioritizing the needs for ASF response. So ASF is kind of one of the biggest priorities right now. The other big priority, of course, is AgView, which is that producer-funded database for swine movement that is designed to give animal health officials access to that movement information in the event of a foreign animal disease. And we're seeing some increased adoption of AgView and really trying to work with producers and animal health officials alike to make that as useful as it can be.
And those look like very, important and interesting projects to work on. What would be taking advantage of your experiences and perspectives from the different roles you've taken so far? What advice do you bring to the table to jointly work between the regulatory and industry organizations in the benefit of animal health going forward?
Yeah, great question. Yeah, and I've been fortunate throughout my career to work with producers in the industry, diagnostic labs, regulatory agencies, all on behalf of the livestock industry. And of course, regulatory agencies exist and have the mandate to protect public health and animal health while being good stewards of public resources. They have the authority then to safeguard animal health, and that's their mandate. But industry organizations have a partnering role there as well. They can complement the technical expertise of the regulatory agencies and often bring resources that are necessary to be successful in those efforts. I think also industry is kind of where the boots are on the ground there, and livestock industry partners are really the ones that are responsible for acting at the farm level to implement the strategies that will protect and improve animal health. So at the end of the day, it's really important that all of those players work well together. It's going to take a collaborative and coordinated approach to continue to prevent and prepare for foreign animal diseases. And so anytime we have an opportunity to communicate and work together on those projects, I think is really what's necessary there. I've really enjoyed participating in the U.S. Animal Health Association because I think that organization provides a unique way in which regulatory agencies, producers, the industry, diagnostic labs, and academia all work together to solve complex problems for animal health. So those are some of the things that are necessary, and then just continuing to work together and in a collaborative way.
Seems like collaboration is a big keyword there, right? Let's get together and work together.
That's right. Yes.
And that's great if you think about collaboration and you look for the SDRS, that is a collaborative effort between different VDLs, and they work together with the USHA at some part also. It's amazing what we can do when we are collaborate together and look for a end collective goal to provide information, help each other. So that's that's a key word in between all of those things.
That's right. Yeah, very good.
Dr. Oedekoven, we can move to the next question. That is, the current economic burn in the U.S. swine industry comes from the endemic agents. So how could understanding the activity of the endemic agents could help in us to prepare for FAD outbreaks?
Yeah, well, you're right. While we talk a lot about lately about preventing African swine fever virus, we've never had a case here, so it's not a current cost to the industry. Meanwhile, we've got diseases like PRRS and others that you mentioned at the beginning of the podcast here that are the big draw, the cost to the industry. And so, but I think there are synergies there, and in general, better understanding of how pathogens are transmitted and how to mitigate those threats to animal health have an additive effect on animal health in general. When we study endemic diseases, we gain competency in the technologies such as diagnostics, bioinformatics, epidemiology, and other areas that continually add to our knowledge and understanding of how we prevent and control diseases. So, we've got to have people like yourselves who are involved in those areas of study who are, as I like to say, the smart people, who are going to help us through those issues that we may be facing. So maintaining good diagnostic and epidemiologic and bioinformatic tools, I think, are important, and we do that on endemic diseases. But of course, keep those tools in the toolbox for an animal disease response. From a producer standpoint, I think it's important to understand those endemic diseases and how to control those, because if you can, and I encourage producers to develop a relationship with their veterinarians so they can develop a biosecurity plan. That's going to be key to preventing both endemic diseases and foreign animal diseases. And if you practice those biosecurity strategies every day, that's going to go a long ways in preventing both endemic and foreign animal diseases. So the other thing on that note is it's good to establish metrics with the veterinarian about mortality, expected mortality and morbidity, and continually submitting samples to a diagnostic lab so you have that baseline knowledge of animal health on the farm. And that's going to drive the early detection of foreign animal diseases if we have an introduction.
And you have been talking about these foreign animal diseases being a priority of the National Pork Board, and if you look for that, we are seeing a lot of foreign animal disease outbreak in other countries. And if you look for the La Española example, we have this African swine fever that is neighboring our country right now. So, in your opinion, how could the U.S. industry get better prepared to rapidly respond to this foreign animal disease event in the unforeseen event of introduction here in the U.S.?
Yeah, great question, and it'll sound like a broken record, but going back to biosecurity, I think one quote that I heard from Juan Lubroth, who was formerly the chief veterinarian of the Food and Ag Organization, said it comes down to biosecurity, and biosecurity, but not necessarily in that order, he said. So, it is so important, and it's an easy word to say, but it's hard to do well. And I think that's evidenced by ongoing disease outbreaks that we see, endemic diseases that in many cases are, you can trace back to a lapse in biosecurity at some point. When you have a break of something, you're gonna find that it comes through at the weakest link of that biosecurity plan. So continually reviewing biosecurity is an ongoing job. It may not be fun and it may not be exciting, but it definitely is something that we can that everybody can do. Whether we're talking about internal biosecurity on a farm or external biosecurity of practices to ensure that we're not bringing diseases onto the farm, or even at our borders and our ports. There are always things that we can do better to improve our mitigation of foreign animal disease coming to the farm level. So biosecurity, number one. Secondly, I think we can go a long ways in improving our traceability and making those movement documents available to animal health officials if needed. Mm-hmm. We're encouraging everyone to create an AgView account. AgView has already been paid for through checkoff dollars, so there's not an ongoing cost to producers to do that. Go to agview.com and create an account and find out how you can start entering your movement data so that it's there in the event that a foreign animal disease needs to be traced back, and that movement data can be critical in either excluding a farm from a investigation, or ensuring that we've got all of the potential contacts included in a particular trace. So that's really important. And then finally, I think it's important again to have a routine surveillance plan on each farm, and don't be afraid. I think it's important that producers and veterinarians understand that it's not a bad thing to report suspicious signs to your state or federal animal health officials. Many state and federal animal health officials have been trained in foreign animal disease diagnostic work. They've been to Plum Island. They've seen African swine fever, foot and mouth disease, and others. But if they don't continually exercise their ability to go out and conduct a foreign animal disease investigation, they lose some of their skills that they've been trained to do. And it's important to report suspicious signs early, because if we want to have the best chance of responding to and recovering from a foreign animal disease, early detection is going to be key.
And for those factors, like you said, the best way to get ready for a rapid detection, rapid response is by using those tools for the endemic diseases, right? So you don't need to wait for an FAD to start using AgView and improving your biosecurity and doing surveillance, right? Those key pillars you got to be practicing those today to be ready.
Yeah, actually, so you can do all of those things today. You can have a biosecurity plan, and there's some resources on securepork.org that will guide you through developing a secure pork supply plan, but which is also a good thing to do. But in general, just having a biosecurity plan that your veterinarian has helped design, and then, as you mentioned, having an AgView account, everybody can do that now, and having that information done ahead of time is really critical, I think.
Important to have the three factors that you mentioned, right? The biosecurity, the traceability, and continuous surveillance working them together. And I think also the swine industry have been seeing value on this, right? Because, for example, PED, if we think about, people would think that they would have a good biosecurity, but when PED came, we had to improve biosecurity, and that helped with PRRS. We have the SDRS data, for example, increased use of populational samples, people using monitoring more their farms. Now this traceability, so the AgView tool is a great component. They all have to work together, right? These three components.
That's right. Yep, exactly right. Yes.
Dr. Oedekoven, our final question for you is, do you want to send any final message to the swine industry, to our audience?
Well, it is an exciting time to be in the pork industry, and I've enjoyed my brief time with the pork board, learning about some of the other areas outside of animal health that are going on too. For example, the pork producers, I think, are leading the conversation right now on sustainability and telling customers and the public how pork producers are committed to continuous improvements on their farms to do more with less. It's interesting to learn about like carbon credits and all of those things that are wrapped into sustainability. So exciting times going on there. And then, of course, just the great opportunities that are being developed for marketing pork, both domestically and internationally. So a lot of good things going on. And, of course, as part of the base of that, protecting animal health is an important job, and appreciate what all of you do in carrying out that role as well. So excited to be here in partnership with everyone involved in pork production and animal health. Thank you.
Well, thank you.
Thank you, Dr. Oedekoven.
Very good. It was a great discussion. Thank you, Dr. Oedekoven, for joining us today. And that was it, guys. I hope you guys enjoyed this special edition that we had. And see you guys next month. Thank you.